As a pediatric hematologist oncologist, I take care of a lot of children and young people with bleeding or clotting disorders. Some of my most challenging patients, though, have been those who have both bleeding and clotting at the same time. A particular patient that comes to mind is a young patient of mine who we had been following for quite some time for a condition called von Willebrand disease, which is a bleeding disorder. It actually ran in her family, so she was diagnosed when she was fairly young. At the time, her only symptoms were really bruising more easily than other kids, maybe the occasional nosebleed, but nothing too serious. We would see her 1 to 2 times a year. Eventually, when she became a little bit older, became a teenager, starting having periods, those were a little heavier, and we would talk about how to manage them. Unfortunately, around that time, she actually also started to have some new symptoms not related to her bleeding disorder, some belly pain, diarrhea, sometimes with blood, and everything just didn't seem right. So she saw one of our gastroenterologists, and she was eventually diagnosed with a condition called ulcerative colitis, which is an inflammatory condition of the bowel. She did okay, but really wasn't terribly well controlled. And when she was maybe about 14 or 15, she came to our emergency room after having had probably a couple days of really bad stomach pain and diarrhea with some bleeding. She was pretty dehydrated and so really needed our care. During her time in the emergency room, she was acutely disoriented and confused. It was really unclear what was going on, but we knew she had a bleeding disorder as well as this bowel disorder, so we made sure that she had a CT scan thinking that she potentially could have some bleeding. And unfortunately, what we ended up finding out was that she was having a stroke. Time is of the essence when it comes to something like a stroke. They're more common in adults. We don't really see them that much in children, but this is a unique situation where, unfortunately, not only did she have a bleeding disorder, but her inflammatory bowel disorder and the dehydration is just a perfect storm of unfortunate events that she was actually more prone to clotting at that moment. So given her bleeding disorder and not wanting to make that or the blood in her stools worse, we had to really balance what to do with the stroke. But ultimately, we started her on the blood thinning therapy that she needed and had to balance that with infusions of the von Willebrand factor, which is what her body needed to prevent excessive bleeding. Remarkably, and given the great multi-specialty care that she got from all the different services, she managed to make a complete recovery, which is quite remarkable. And I managed to continue to take care of her for quite some time, getting her through high school and enrolling in college. And now she's interested in the healthcare field. So it's just a reminder of why we do what we do.